Hello everybody, welcome to DOCSHAALA. So today our topic of discussion is ugly duckling stage. So ugly duckling stage was discovered by a scientist named as Broadbent. So hence it is also known as Broadbent phenomenon. So let us see what happens in Broadbent phenomenon. So here is the image showing the ugly duckling stage. So here you can appreciate that the permanent maxillary canines are getting erupted. So as they are getting erupted, what they are doing is they are exerting force on the roots of the lateral incisors. So roots of the lateral incisors, they are exerting force. Because of this force, the roots are being displaced towards the mesial side, and in turn they are exerting force on the central incisors, and because of this the central incisor roots are also getting displaced towards the mesial side. So this is so because of this the crowns are getting displaced towards the distal side, and this is creating a space in between the two maxillary central incisors. So this midline spacing is what is making the face of the child look ugly during this stage. Okay, so from all these things what we came to know is the main culprit in the ugly duckling stage is the erupting maxillary canine. Okay, so this is the main culprit. So let us see how the child looks during this ugly duckling stage. So here is the picture of the child. So here is a girl who is showing the ugly duckling stage very prominently. So you can see the appreciate the midline spacing that is happening over here. So you can see that all her facial features are normal except that her smile is getting affected because of the ugly duckling stage she is going through, the midline spacing that is happening over here. So let us just see the same thing on a radiograph. So here in this radiograph you can see that the permanent canines are getting erupted, and these are exerting force on the roots of the lateral incisors which are getting displaced mesially, and thus exerting force on the permanent maxillary canines. So because of this the crowns are getting tipped towards the distal side, and hence creating a space between the two maxillary central incisors. So because of this midline spacing the child in this space looks ugly. So let us see when does this happen. So this happens during the growing age of the children. So when the child is of 8 to 9 years of age. So why it happens only in 8 to 9 years of age? So we'll come to know this before that we'll just see a clinical scenario. So often we see patients walking into our clinics bringing their kids along with them and complaining that there is a space creating in between their teeth, and the child is looking very ugly, and because of that space the child is going through a psychological trauma, and they want it to be getting corrected as soon as possible. That whenever you are getting a child with such midline spacing and who is of around 8 to 9 years of age, don't suggest any treatment for that child. Why is this? Because this ugly duckling stage is actually a self-correcting anomaly, or it is also known as a transient anomaly. What does this mean? This means that the anomaly does not require any treatment, and hence intervention should not be made. Then how does this get treated? Will that child look like that for his entire life? No. So it will get treated like this. So from this image you can see that. So as I have told, as 7-year-old child, here his canines are getting erupted, and these canines are forcing the lateral incisor roots, and thus creating a midline space. So this is seen in between 7 to 9-year-old child. Okay, 7 to 9-year-old child, the child is going through ugly duckling stage. So as and when the canines are erupted into the occlusal table, you can see that the roots of all the 4 incisors are getting into their normal positions. Because they are getting into normal positions, the crowns are also getting into the normal position, and thus the space in between the 2 maxillary central incisors is getting closed. So this is how the ugly duckling stage gets treated. So it gets treated as in when the canine gets into the occlusal table, or by the time the child reaches around 14 years of age. So what is the erupting age of the permanent maxillary canine? So anybody, they can say. So it is around 11 to 12 years of age. So by this time the teeth start moving towards the normal occlusal plane and the midline spacing gets reduced. Okay, so the important points which lie around ugly duckling stage are that it was discovered by Broadbent, and hence also known as Broadbent phenomenon. Okay, so it is occurs in the 8 to 9 years of age, and the most commonly affected teeth are maxillary central incisors. Okay, so the treatment here is no treatment, and hence no treatment, it is called as self-correcting or a transient anomaly. So these are the 5 important points that lie around the ugly duckling stage and which should be remembered for lifetime. Okay, so this comes as a very important short answer question, MCQ, or an image based question. So just remember all these 5 points, so that is enough for you to answer all these questions. So I hope this makes your concept clear. Okay, so if you like our video, subscribe to our YouTube channel, and you can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA Medical for medical content, and also do follow us on our Telegram handles. Thank you, and see you again in a next session.